Dr. Brittany from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case involves a patient who presented to my office with headaches. The headaches were quite frequent, about 2 to 3 times per week, and seemed to come on more in the evening time. I did an assessment of this patient and figured out that their headaches were being caused by trigger points in the muscles surrounding the jaw. Tension in the jaw can be caused by a few different things. Obviously, dental issues will be one factor, but most of the time they are due to stress. People will tend to grind their teeth, hold a lot of tension in their jaw when they're stressed. So obviously addressing stress in your life is a big factor of this as well. For treatment for this patient, what I did is started with some activator in the upper neck area. If there's a lot of tension in the upper neck area, this can also really have an influence on the jaw, so that's why I looked at this area. I also did some pressure point release work on the skull, specifically the sphenoid, which is in the temple area, and then the frontal bone here. And then, of course, we worked on the muscles around the jaw. So I did some trigger point work on the outside of the jaw, and I usually like to use a handheld massager to use some vibration through my hand while I do this. And then I also did some work inside the mouth to release those muscles. And then lastly, we did some stretching for the jaw. And I sent the patient home with some stretches to do. And after a few weeks, the patient's headache frequency had decreased.